Great. So I think everybody is in the room now, so we'll go ahead and get started. Um, my name is Josh Ehrlich. I'm one of the associate directors of the Center for Global Health Equity and run the Data Collaborative, which I'll talk a bit about before we get started. But I also wanted to thank all of you for being in attendance today at the first of what will be a series of seminars, ongoing seminars that the Data Collaborative of CGHE will be running. And so we invite you to keep an eye out for announcements of future seminars as well. And thank you for being here for the inaugural seminar. Um, and I guess we can go ahead and go to the next slide, Christina. Yep. So just for those who don't know, I wanted to introduce the mission and kind of foundations of the Data Collaborative. The Data Collaborative within the Center for Global Health Equity at U of M was founded in order to convene, consult, and collaborate with partners around the globe in the hope that we can utilize data for better health. Our functions in the Data Collaborative are organized around three key pillars. Next slide. And those three pillars are illustrated here with the different colors of the wheel. And they're organized really, the pillars into data acquisition, curation, and harmonization, responsible data science, and data dissemination. And so the activities of the Data Collaborative really fit within those three pillars and aim to not necessarily carry out research on our own, but to create a data science infrastructure and environment that facilitates equitable global health research for ourselves, our partners, and the world at large. Next slide. One of our activities on the dissemination pillar is this Data Collaborative archive that we've recently launched in collaboration with ICPSR at the Institute for Social Research. And through this archive, the idea is to make global health data more discoverable and more accessible to the global health research community. So we invite you to check out the archive. We're happy to distribute the information. Perhaps, Christina, we could even put that in the chat, the web address to access the archive, which is in development and being built out and expanded continuously. So keep an eye out for those developments. And final slide before we get started. I also wanted to announce that, and I think this is the first announcement of this, that the Data Collaborative will be offering pilot funding for the first time. This new program is looking for projects that are focused on action-oriented data science. So we're looking for teams that are aiming to create data science tools to advance the field of data science. We're thinking about models, methodology, apps, these kinds of things that will really help the community at large. We are going to be offering these grants of up to $25,000. And there'll be a formal announcement and call for applications coming out soon. And the deadline for applications, just for those who are planners, is going to be February 27th of 2026. So still quite a bit of time. But as that announcement comes out, I invite you to go ahead and start forming teams and thinking about proposals. With that, I will stop talking about the Data Collaborative, and we will move on to the reason that we're all here today, which is to hear from a colleague and friend, Gurpreet Rana, Preet. And for those who don't know, Preet is the Global Health Coordinator at the Taubman Health Sciences Library. She has a wealth of knowledge when it comes to information science and library science, specifically in the global health space, a tremendous resource that we have at U of M. And we're very grateful to Preet for being our first seminar speaker for the Data Collaborative. With that, I will turn it over to Preet.
Thank you so much, Josh. I can't say how honored I am by your words and to help kick off the first session of the Data Collaborative webinar series. So thank you so much for having me. So today I'm going to go ahead and start sharing my slides. I might actually look away from you because I'm working on two monitors. One has all my web content on it. So I'm not trying to be rude, but I will probably look away from the camera for a moment. We're going to be talking about introduction to global health. Now that's huge, introduction to global health data. So there's a lot to unpack there. I had to be a little selective, and I hope that the tools that we are going to be looking at are going to be helpful to you. We're going to be focusing on open data tools. First, because I know there's some people on our call that are not University of Michigan users. and I did not want to share any content that is behind a University of Michigan paywall. That also being said, I want our colleagues to be able to share content and share free content resources with the colleagues and researchers that they work with around the world. Are you seeing my slides?
Yes, perfect.
Yeah. Okay. So the intended learners today, and you may or may not fit into one of these groups. I just wanted to share that with you. Is for those who are interested in getting started in exploring global health data sources, those with less experience assessing global or epidemiological sources, or those who are experts in the areas and just want either a refresher or an exploration of new tools you've never seen before. This is just as data is progressing in the global health sphere, we're getting more and more data visualization tools, and also different ways that we are working with these tools. So again, just if there is something new to you, if you do have questions, please do share them with me. Also, I like textiles, and textiles are something that I appreciate. I'm of Kashmiri origin, and textile art is a very big part of our culture in Kashmir. And so this textile is I believe it is an Indonesian textile, and you'll see that it's made up of many parts. And that's just as how the diversity of those of us who work in global health is shown here as well. Again, in recognition and the diversity of what we are doing, I do recognize that health data represents lives, personal stories, and the human condition. There are people behind the numbers, and that is something I remind myself, and I just wanted to share with you as well. These are my slides. I'm going to do a quick share on chat and put those up. So if you want to work with me, you're welcome to do so or share along with me, or you can just watch the presentation. So I just wanted to make sure that those are available to you. So before we get started, something that we do need to mention is that we are in a time of change. And a good way for me to present this idea is the way that we presented to some of our students when they have challenges accessing certain data sources, or we need to consider alternative source material for them from time to time. And this is about changes in US data, which impacts some of the global health data that we are using, and some of the links, some of the content there. I'm not going to go into this in detail, but these are link outs to articles that are in the mainstream media, but also in sources that are other sources like the Kaiser Family Foundation. The very last link there is a look of federal health data that was taken offline. That's as of February 2025. Every day, something new is happening. We need to acknowledge and recognize that data sources are being modified or changed in some way. So just to keep aware of that we also need to keep in touch with how data is changing, our access points are as well. What will we cover today? Before we do start, I do want to say this is one of my favorite photographs. It is from PhotoShare, previously from USAID. And it's an infant who is receiving a vaccine in a health center in Nampula City in Mozambique. And in addition to that, what are we doing? We're going to be looking over the global health guides, which I do curate for the university library system. We're also going to be looking at selected data global health sources that I'd like to explore. Thirdly, one of the most important things when you're exploring a community is, if you can access it, to access census and government data for those locations. Fourthly, we're going to look at data visualizations, particularly the global burden of the disease data visualization tools. And fifth, we're going to do, if there's time, we'll go into our Sustainable Development Goals data. And again, just a very cursory look at all of these tools today. So the global health guides, I'm actually going to go live with this one. So I'm going to stop sharing my screen. And I wanted to show you, this is the global health guide that I curate. And the guides, excuse me, plural. And before I go on, I do want to focus on this photograph. This is a photo I took in July 2019. Some of you may actually recognize the location. This is Komfe Noche Teaching Hospital in Ghana. And it's one of my favorite pictures that I've taken there. Just looking at the gardens area of the of CAF in Ghana. So I wanted to share that. But along the Global Health Guides page here, you'll see connections out to other guides. This is everything from the flagship guide I curate called the Global Health Guide. But then we also have a guide for UN SDGs. So representing every single SDG, just a way to get started with the 17 SDGs. The Global Nursing Toolkit, I think that's a little self-explanatory for whom that is. We also have the Refugee and Displaced Persons Guide. And that, of course, it can be for war, conflict, climate refugees. It's a lot of policy information and data. Next, we have the Sexual and Gender-Based Violence Guide. This is heavily used by some of our students in particular classes and by researchers around the world. Then we have our Global Eye Health Guide, and this was created in partnership with the Kellogg Eye Center, and everything on here is openly available. Let me say that again. Nothing in the Global Eye Health Guide is behind a firewall. I'm going to say the same thing for this Global Sexual and Reproductive Health Guide. Although there's some content on the Global Health Guide that is specific to University of Michigan users only, I have deliberately made sure that the Global Sexual and Reproductive Health Guide has no firewall. Because of this, I would encourage and ask you to share it with your colleagues worldwide. As long as they have access to internet and are able to get to a good Wi-Fi source, etc., they are able to access these materials. So again, this just kind of goes over these are just screenshots. I like to have screenshots because I don't trust technology. So you can just see where you can go ahead and take a look at some of our tools. And under the Global Health Guide, the flagship guide that I was talking about, we are going to be looking at the section on global data and statistics and global burden of disease. Under global data and statistics, you're going to see a lot of information. It's a little overwhelming. I don't want it to be, and I have tried to edit content, but there is quite a lot that we want to explore. Independently, I encourage you to explore our general sources, regional, those that focus on maternal women and child health, nutrition, infectious disease, SDGs, others, and you can also see tools that allow us to visualize data, either for our presentations and research, to understand data better. We can often see trends that we may not see on a spreadsheet. And then also, this is quite good for presentations like I'm doing right now. So thinking about these data visualizations are quite helpful. The majority of these data sources are freely available. If they are specific to University of Michigan users, that information is provided on the guide. So moving along here, these are three of the global health sources that I decided to kind of explore. And by the way, if you do have any questions or comments, please share them in the chat. And I will ask Christina if you don't mind taking a look at that, and I will also periodically take a look as well. So selected data sources that we're going to be focusing on. The WHO has so much data, and one does not know where to start because we can go to just the main global health data repository and pull so many different indicators, thousands of them. I decided to go to a tool that some of you may not be aware of. It's relatively new. It's called the WHO Health Equity Assessment Toolkit. The second source we're going to be looking at is the World Bank Open Data, one of my favorite sources to start out with when I'm researching a topic area in global health. And thirdly, we're going to look at a catalog, maybe not so different from the data archive, but we'll see. I was unaware of the data archive that we are creating here at Michigan, but this has some similarities to it, I think. So let's go ahead and take a look at the Health Equity Assessment Toolkit. And this provides us with disaggregated data. Very often, it's difficult for us to find disaggregated data, and where should we look for it? This is a screenshot from a YouTube video that the WHO made explaining the Health Inequality Data Repository. And they describe it as the WHO Inequality Data Repository aims to make disaggregated data more accessible and support the process of quantifying and assessing inequalities. Because we are the Center for Global Health Equity, I thought this would be an appropriate source to get started with. So the WHO indicates this is the largest collection of disaggregated data about health and determinants of health that it is out there. And when you use the tool, you're going to use it through something called the Health Equity Assessment Toolkit. And the short form for that is HEAT. And so we'll go into that a little bit. Next, I like to explore tools and share them using questions. So a research question or a query that you might have or you might want to explore, because it gives you the strength of the source material. It's a real evidence-based approach to looking at sources. So here's a question that I created. I want to explore maternal postnatal care in relation to educational status and subnational region in Zambia. And I do this also in honor of the Empowering Women and Children group, which I'm a part of for the Center for Global Health Equity. Let's take a look at the source. I'm going to go ahead and click right into it. And when I do so, what I'm seeing here is more information about the tool. There's a video. It gives you some data sets. What are you actually looking at? You can download an indicator list. It's never ending here. I'm going to just go right into HEAT, into the Health Equity Assessment Toolkit. When I do that, what it says is, okay, well, you have some options here. Which data set do you want to go into? And there are several here. There are the SDGs, there's the WHO Observatory, but then there's also non-WHO data that's available. And that may be under migration. There's Eurostat data about for European statistics. Or is there environmental health information from the WHO UNICEF joint monitoring program? I'm actually going to go into the section called Reproductive, Maternal, and Child Health. We can see that I can look at household surveys. There is information here from the UN IGME, so it's mortality estimate data, but I'm just going to keep it as it is, and I'm going to say, okay. So now the system, the data set is now loading for that particular source material. Immediately, what I'm seeing here is Indonesia. I'm not sure why it starts with Indonesia, but there it is. To get a better understanding of what this looks like, here at the very top, we have our languages. So there's English, Spanish, French, and what does PT stand? Portuguese, I believe. And then we can change our data sets here as well. There's more tools along the top as well. We have options for downloads, options for sharing. But I'm just going to do kind of a basic search here. So where it says Indonesia, I'm going to type Zambia very slowly. And so that comes up for me. And then it says make a selection with data sources. I could choose DHS or the ICDHS, UNICEF. And these are, or I could look at UNICEF mixed data, so there's different sources. I'm going to actually leave them all. If I wanted to, I could look at the most recent data set. Again, I'm going to leave them all. The first thing that comes up for this data set is births attended by a skilled health worker, the percentage. And so that is something that people often do want to look at. I'm going to turn that off. And I'm going to start very slowly typing. And as I do that, you can also see some of the indicators that are available to me in order to create a data viz. So I'm going to type in postnatal care. That's what I'm looking at. As you note, it's very easy to get lost and forget what you're searching. Postnatal care. So we have two measures here. One is postnatal care for the mother and postnatal care for the newborn within 2 days of delivery as a percentage. I wanted to look at maternal care. So I'm looking at postnatal care. And now I'm looking at Zambia. What we are seeing here is the economic status by wealth quintile. Here are other ways I can disaggregate data. And if we go back here, we wanted to look at educational status and subnational region. So if I go back in here, I'm going to remove economic status, and I'm going to change this to education. We can group it in four areas or three. So I'm going to go ahead and do four. I'm also going to add subnational data in there. What I'm now seeing is that information presented to me. This looks like the most recent data they're presenting here is the DHS for 2018. This is one way for me to present the data. I could look at this information as a vertical bar. So what I'm seeing here is education, and these are the subnational data. The subnational data doesn't look so great in this vertical bar format, but I'll show you a way that it does actually help us to explore. Here under horizontal bar, what we're seeing is the educational information in connection to postnatal care for mothers within a 2 day days of delivery. If I look at the map version, this is where I'm going to see more of that that data that is more impactful when one would look at the subnational data. So here, as I hover over each piece of this, I'm seeing South, I'm seeing I don't know how to say this correctly, so please excuse me, but it's Iwapula, and seeing this information. It looks like the most recent information available for this particular measure in this source is 2018. I'm not saying that is the most recent information, but that's what we are finding here. I still think it's going to be relevant and useful for the work you're doing. There also is a table view. This is very important because we all have different levels of accessibility. So although data visualizations are excellent, we also want to make sure that we address different levels of accessibility and different ways people can find information. This information can also then be downloaded. Let's go back into our screenshots just to kind of quickly go through some of that we did go through. So taking a look at what we did here, I do want to highlight some other tools here. What you'll see here, and this is a screenshot. So under explore inequality, we were looking at disaggregated data. We could look at summary measures. What does that look like? The summary measures gives us the aggregate data. So it's exploring inequality in the country, but it's summarizing that information there, right? Now, we could look between countries. We can compare inequality, and that provides us with disaggregated data or summary data for those countries. So if I click here, I'm looking at comparing inequality for disaggregated data, and it looks like these are all DHS for different countries that are around the Zambia area. So these all are in sub-Saharan Africa. And they are also different years, so that should be also mentioned. If I look under summary measures, what I'm then going to find is comparing this information between countries. So looking at how that might appear for the subnational data, what is the comparison on a different way of viewing it this. So the way we also view data can also have a different impact on the funder, for instance, or on a class, or on even our understanding of the way that we show data. So that's a very, very, very quick look at that particular resource. And I'm wondering how many people have used it. If you have, and if you do want to share any comments about it, please let me know. And I'm happy to work with you with the various tools that we are looking at today. I did mention that one of my favorite tools is World Bank Open Data when I just get a topic and I'm kind of exploring. It provides a multi and interdisciplinary approach, and it also gives me access to microdata. Everything on here is freely available. Let's take a look. This is World Bank Open Data, and it has recently it looks different than it did like 2 weeks ago. There's been a new screen. So they've added a new way of presenting information that they called Data 360. So if we want, we can go right into information about people or prosperity or planet. We need to understand how important climate change is, infrastructure, and then digital. And how all these pieces make up information about global development. It is exactly what it says. It's free and open access to global development data. Before I actually do a search, I want to take us into the fact that we can look at indicators on an individual level to better understand what's in here. And it's taking a moment to load. So we will let it do that. And we will go back and take a look at one of our sources before, come on, you can do it. I have a feeling that many people are entering into World Bank Open Data at the exact same time, and that can slow it down. Let me go ahead and explore using an example question I have. I'm going to explore the number of IDPs in the Democratic Republic of Congo. And I want to look at this for war and conflict, not for disaster. So displacement according to that. I want to see it over time. How does this compare to countries in the region? And that's something that we can take a look at here. So let's first enter very slowly, type in internal displacement. So if I just start typing in internal, what then comes up are some of the measures that are available to me. These could be health, these could be infrastructure, it could be climate issues around global development. And you can see the ones that are coming up here. I want to see internal displacement, new displacement associated with conflict and violence. That's actually the one that I do want to explore. You will see that there's a differentiation here between disaster and the IDP around war and conflict. So I go ahead and choose that option. What I'm now seeing is just a map of the world. I'm now going to very slowly type in Congo. And when I do that, I'm going to get two options coming up. The one I want to see is DRC, Democratic Republic of the Congo. So I'm going to choose the second option here. After I did this, a data visualization has been created. I've answered my question that I'm looking at the internally displacement over time. There are some things that are important when you're looking at a data source. Where did this come from? So here's the source information. It came from the Internal Displacement Monitoring Center. That is a very well-known and respected organization when it comes to collecting data on IDPs. It gives us a link into that source so we can go into it into even more depth. We see that this is open data. It has a license. I can use it as long as I attribute it to the source. I'm looking at a line graph here. So I can see in 2023, unfortunately, internal displacement is increasing in the Democratic Republic of the Congo. And I see it at around 3.8 million in 2023. I can also look at this as a bar. So if I was looking at more than one country, I could enter in another country here and see how those compare or contrast. I can click here and look at this in a map view. So this may not be as useful for when we're looking at information over time. So another thing to better understand is if I click on details, this gives me a definition of what internally displaced persons, new displacement associated with war and conflict, number cases, how is that defined? That's important information to have. The other thing, it gives me some basic idea of how this information was gathered. And that is also important to have. To have the metadata behind the data itself is useful. And if you are, for instance, using this with students, if you're teaching a class, it is important for our students to realize where information is coming from and how it's collected. Now, I said I also wanted to see how this particular measure compared to countries around Zambia in the region. I'm going to click on also show, and I'm going to click on same region. So what now happens is, I don't know if you can see these gray lines very well, but these are countries in the same region that have that measure. So I can see here's Ethiopia at close to 800,000 in 2023. How has that changed over time? So there's so much we can do with this. We can also narrow this down. Maybe we only want to see a smaller length of time. Maybe we don't want to see 2009 to the most recent one, which is 2023. So I can animate this graph in different ways. Also, using technology that's similar to if when you're using some kind of product, like, and I'm not being glib about this, but let's say you're on Amazon, and if you like this product, you may also like this one. Using that type of technology, collaborative technology, it also is just telling us that if you like this measure about internal displacement, you also may be interested in other information that is around issues of war and conflict. So I could go to these other, there's a measure here about battle-related deaths or internal displacement in relation to disasters. If I scroll down the page, I can then see countries that have, that there is reporting information about this particular data point. And I can see how those points are have been graphed. What is the trend line? So for Bangladesh, you can see the trend line here. It's kind of gone down, and it has been kind of steady. But for others, for Burkina Faso, we see it go up, and so for Burundi, we can see it's going down and becoming more steady. This is one of those tools that I feel can be a very much of a rabbit hole resource. There's so many different things that you can do with it. This again just is our screenshots taking us through and reviewing what we just looked at with links out. So if you do get the opportunity, you can look at that. This is another screenshot that's showing you the same measure we were just looking at. But looking at the screen, I wanted to point out that you can get micro data, survey information from World Bank Open Data. They might not be the ones collecting it, but they are they might not be the ones that created it, but they are collecting it for our needs. There's a data catalog that offers so much information, everything from economics to health to infrastructure. And I'm going to allow you to explore that as well. One more thing before I move on to the next screen. This information we collected, we can download this to an Excel spreadsheet. So here you see Excel, XML, or a CSV spreadsheet. So you can take the information and work with it for your own needs. This is the link out to the micro. I clicked on microdata, let's pretend. And then this is what I'm seeing here. So these are some of the featured collections in the microdata archive that World Bank Open Data makes available. And I decided I wanted to look at information about the Rohingya. That because this is a very significant refugee issue in Bangladesh, and because they have been stateless, the Rohingya are an important population. So I decided, let me see if there's a data set about anything about the Rohingya. So I did that search, and I found a 2021 data set on the intention survey of Rohingya refugees in Myanmar. And in this case, there is microdata that I can access. And I can see the link there. I can see the data description, the documentation, and the way I would get microdata. In some instances, you might have to register, even though the data is free. In some instances, you can just download the data as well. Do we have any questions or anything? Let's see. I don't think so. But yes, so please do let me know if you do have any questions or comments. And the next source we're going to look at, again, from just one of those general global health sources, is the Institute of Health Metrics and Evaluations Global Health Data Exchange. I'm going to use screenshots just because it'll be a little faster for us to get through this one. Let's say I'm looking for information about survey data in Brazil. And I'm gonna use the IHME Global Data Exchange. And this is a screenshot of what it looks like. I can look at information. I can put in a keyword, data type, organization, or I can choose a country. I also can see what are some new data sources that are in here. The data sources that are in here are ones that are used to inform the global burden of disease study by the Institute of Health Metrics and Evaluation. So they are collecting those sources and making them available for us. We may not be able to access the data, but we know it'll exist if it's in a catalog. And in some cases, we can access the data here. So I chose Brazil. And I went to the next, I clicked that and I was taken to this next screen. So I can see a lot of the different sources on Brazil. I can look at census data or if there is demographic surveillance or epidemiological surveillance data, geospatial information. I clicked on survey. And when I did that, it took me to this page. This was yesterday. So I can see there's information about domestic violence against women. There's a survey there. And then there's also one called Latino Barometer 2023. I decided to look at that to better understand what that was. Here's the record for that particular source and the citation. And it gives me a description of what this survey is. In this case, I am able to click here and download freely without registering the microdata source for Latino Barometer. One thing that I think that moving on, one of the things that I think that we often overlook is census government data, census and government data. And when I'm exploring, this is a place where we go to very often. A good example of this is when we're teaching community health assessment as an informationist at the library. One of the first things that we teach for our students working on US community health assessment is how to use the census data. Because that better informs you about the communities that you're working in. So let's say I'm interested in census data, and this is just an example because there's, of course, every country has their own census. It may or may not be available to us, but if it is, we should take advantage of it. And in this case, I looked at Mexico. I think it has a very good infrastructure for its government and census data outside of the US. So if looking at health and inequities in Sonora, Mexico, I decided to go to their source called INEGI. And when I went to INEGI, I did use the English language version. I do not speak Spanish, but you can toggle this into Spanish if you prefer. So in here, when I went into the INEGI system, what I can see here is information that I can now pull on demographic, societies, population, health and security to better understand Sonora, Michigan. It's not in Michigan, it's in Mexico. And also the maps, publications, services to better understand the area as well. The government of Mexico also makes a source available through it's I believe it's the Ministry of Economics, and they make a source called Data Mexico available, which is a data it's a data repository, but it also allows us to look at much more specific areas of municipalities. And this is just an example of that. I looked at Sonora and I decided to look at inequality. So I clicked on equity and I scrolled down the page until I could see this is showing me an image of Sonora, but within it, I can see the municipalities. This is a screenshot. If it was not, I could hover over each of these municipalities and get the data and information behind it. And what I am looking at here is a measure called the Gini coefficient, which allows me to better understand the economics of an area and the economic inequality between regions or areas. Again, so looking at this can give me so much more information. A census, what's even measured in a census can tell you a lot about a country. One that I found very interesting is the Italian census does measure the average number of vacation days that people take. And that tells me something about the Italian, that vacation and getting rest is important to to society if it's something that they are measuring. So some of you may have used or are familiar with the term global burden of disease. And before we kind of go into this source a bit more, let's better understand what the global burden of disease data, the survey data really is. So this is a study from the Institute of Health Metrics and Evaluation, and it's known as the most comprehensive worldwide observational epidemiological study. And it's been, the data is available from 1990 to the present. And when I mean present, I mean the most recent data set we have is 2021. It took some time for the 2021 data set to come out because there was quite a lot of work that needed to be done around COVID. This is the 2021 data set is the first one that includes worldwide data and regional information about COVID-19 because it was the first time data was collected at that point. So that is our most recent data set. But from 1990 to the present, there are 607 billion data points here that look at health outcomes and risk factors. We're going to be taking a look at the GBD data visuals for country profiles and GBD compare information as well, which is taking us into a data visualization that allows us to explore and work with the data and create our own data visualizations. So just to get started, just to show you where we might find the country profile information, this can tell us a lot about a country. So if I was to go into the particular tool, and in that case, I'm looking at Kenya, but if for Kenya and for some countries, not all, but for some countries, I can even go to the subnational region. So you'll notice here that I'm looking at counties in Kenya. I'm going to take a look at Kenya as a whole. And the type of information that I can explore here, and this is for all populations, all age groups and the entire population. I'm looking at forecasting of the population. Again, I can download this information. I can look at it in a text view, and I can also download it for my own use into an Excel spreadsheet. How the population pyramid. This is extremely useful and information to know about. One thing that I think is extremely telling is how much was spent on health. So this is money that was prepaid. It was out of pocket, what was paid by the government, and what has been paid through development assistance for health. I can then see, oh, look, there's also a link I can go to a more broader report on financing in global health. And this particularly refers to development assistance for health. I can also see more measures about health services, and I'm not going to go through every single one of these, but what causes the most death in Kenya? What are some of the daily deaths that have been attributed to COVID? So there's a lot of COVID in the 2021 data set. Let's go on and take a look at one of the source resources that I want to take you to. And I want to take you to GBD Compare. I could probably do a 2-day workshop on GBD Compare, and I also need a lot of practice with this tool. There's a lot that you can unpack here. We're going to look at this in some of its most basic level. When I click on GBD Compare, which is one of the data visual tools that it's available, this gives me information about the global burden of disease. And as I mentioned, the most recent data set is 2021. What am I looking at right here? We're looking at basically four colors, let's say, three colors. Everything that I see here in blue is chronic or non-communicable disease. Everything that I see on this square pie chart, you can call it, or a tree map, is that is in the hot colors, is maternal neonatal disorders, nutritional disorders, and infectious disease. Everything that I see in green is risk, is injury. So this could be war or violence, or it could be burns. So anything that fits into that creates injury. And the very last one is a new catch-all area called other COVID. These were just, I think this is more of that long COVID type of approach. And we also see COVID here in for 2021 information for infectious disease. So we're looking at the world, global, we're looking at both sexes, and we're looking at all ages. The measure we're looking at is the rate disability adjusted life years. I can make some changes here. So what if I don't want to look at the world? What if I wanted to look at Ghana? I could choose Ghana. And when I do choose that, what do I see? I see that overarchingly for the population, and this is both sexes, all ages, I'm seeing an increase in the 2021 disability adjusted life years when it comes to infectious disease. Let me move this. Let's change this to 15 to 49. And let's look at the female population. Let's see how that changes things. So now I'm seeing there is an increase when it comes to chronic disease, but something that's standing out is HIV. Now, when it comes to something like this, the larger the box, that means the larger the proportion of the disease burden. The darker the color, that means there's been an annual percent increase. So you can see some of those dark colors. If I look at a population under the age of 5, I'm going to see a significant increase when it comes to infectious diseases, nutritional disease burden, and neonatal disorders. If I look at a population over 70, we're going to see an increase in non-communicable diseases as well. So again, this is just one way for us to view the information here. And I'm going through this very quickly. I want to make you aware of this tool, but there's so much to unpack that maybe we'll do another session on the global burden of disease and survey tool and GBD compare data visual. And this just gives you an idea. This again, this is a screenshot for Ghana. And here, I did a measure where I was looking at child and maternal malnutrition. So I'm looking at a particular risk. So I changed the system to look at instead of cause, I'm looking at risk. So under cause, I can look at several causes so here I could be looking at all causes. I could be looking at respiratory infection or tuberculosis. I could be looking at diabetes. I changed this in the screenshot here to look at risk. And one of the risks that we do look at is malnutrition. So I switched it to child and maternal malnutrition. I'm still looking at the disability adjusted life years. I decided to look at an under 5 population, and I'm looking at a percentage of the disability adjusted life years, not the rate. So by doing that, I am coming up with this image, and you can click on that link, and that link does take you to the image I created. So if you click share here, it will give you a link option to share with your students, with people you're presenting to. And you can also download a screenshot if you do want to present this in a report or a paper, of course, citing it correctly with a correct attribution. So we can see, this allows me to see Ghana. So if I can hover over it, and I can see how Ghana fits in contextually to the rest of Africa or even a broader region. Maybe I want to look at Asia in comparison, or I want to look at South America in comparison. So this is one form of data visualization that's available. There are several, but we're just going to keep it at that for now. So just ending with the Sustainable Development Goals. This is an important information tool to use because the SDGs, the Sustainable Development Agenda for 2030 is a big part of countries that are reporting to the United Nations and thinking about how the Sustainable Development Goals are being impacted by change in the country and by interventions that are taking place. And different countries are ranking in different ways, and it's important for us to better understand this. Let's say I want to understand India's SDG progress. So I'm going to look at country profiles. So first of all, I'm going to click on the Sustainable Development Report for 2025. By the way, this is just one SDG resource. The United Nations, WHO, other organizations have many, many different tools that allow us to explore and work with the SDG data. This is one that I like because it is more in that atlas form and one that I do like sharing with our students. So here, I'm going to look at the interactive map, the country profiles, and the data explorer. There's much more to this tool. I can download it. I can read the report, but I'm going to click on Explore Data at the bottom there. And when I did that, I did a map I went to the profile for India. And you could also do this and this actually is a data visualization. I can hover over it. I can explore the time series by going into more detail. But you can see where is India falling within those categories? So is it doing well? Is it on track? Is it not? So that gives us more information about it. Let's say we were taking a look at maternal mortality. We want to know how it's trending for Tanzania. And I can click here and go to the interactive map. And let's say I did that. And if I go to the interactive map, I decided to I clicked down here and I identified the country of Tanzania. And then I clicked here where the 3 lines are, and I changed the indicator. So first of all, I highlighted, let me just go back and do this one in person. I think it's helpful. So first of all, I need to know where Tanzania is. So I'm highlighting that over. And I'm changing the overall score to look at SDG 3, and particularly looking at SDG 3's maternal mortality ratio. So here I can then hover over this. I can go to the country profile, the time series, or I can view this in different ways. What we're looking at now are ratings. I want to look at the trend graph. So by doing this, I can now look at the trend. Where is Tanzania trending? So there are major challenges, but we see here there was an increase in 2023. Their score is moderately improving, but it is insufficient at this time to identify the goal to meet the goal by 2030. And we can also go into one of the 17 SDGs here as well. A lot to unpack, but just a place to get started. This is one that I like to share with students because I like them to not have preconceptions about different countries. This is a comparison of Rwanda and the US for the SDG 5 and gender equality indicator, seats held by women in national parliament over time. Just to show you the screenshot, what I did here was I went into the tool, I identified the selected metric. So I went in there and identified parliament, choose that metric, seats held by women in parliament. I went into the country view, I removed all the countries that were there, and then I went back and chose only Rwanda in the United States. Then I went into view metadata so I can better understand the description of what this particular data point means, and then also getting more source information about it. What I see here, and if this was I can change this from a line chart to other images. What I also have turned on here is the long-term objective goal. Is that being met? And then I can download the image, I can download the data. What I see here is that Rwanda sits at 63.8% of the seats held in parliament by women. The United States is not meeting the goal by far. So at the United States, it sits around 27%. So it's something that I like to show, and I like to show our students not to make preconceptions about different countries. And so one way of doing this is showing, is to use different questions that present that type of information. So that is a lot of information, and I went through it extremely quickly. That's why I'm very glad I gave you the slides. But I just wanted to give you an overarching view of just the richness of information that we can openly use using open data sources. So I'm wondering if there's questions or if there's anything anyone would like me to address, or if there's anything that Josh, Christina, you'd like to indicate or share as well at this time.
No, Preet, I think that was really wonderful and such a broad and appropriately deep, high-level overview of global health open access resources. So thank you so much. I think we really accomplished what we set out to do today, and that's terrific. If there are any questions, feel free to go ahead and put those in the chat. I know Christina had a couple final announcements so that we can plan to end on time. So Christina, maybe you want to begin those announcements, and if any questions come in, we'll take those.
Sure, no problem. I'm going to share some slides here real quick. Well, so the first announcement, if my slides will work, is our next workshop for the Data Collaborative will be on October 14th from 9 to 10 a.m. It's an introduction to demographic health survey data with Dr. Abram Wagner from the School of Public Health. I will send all of this information too, so you can register for these things as needed after. Our next event that we're hoping anyone in Ann Arbor can attend is our community gathering. That will be on October 21st at 3:30 at Palmer Commons. You can register for that as well on our website. And a quick note about some of the programming that's available to faculty this semester. In addition to kind of the pilot programming that Josh mentioned in the introduction, we have both SEED and Impact Accelerator grants available. SEED grants are, aimed towards exploratory projects up to $35,000, and those are due October 30th. Our Impact Accelerator grants are aimed more towards action-oriented projects, and those awards are up to $100,000, and those are due October 3rd. If you have more questions about that program, please reach out to Parina Kamdar, and her email address is on the slide. We also have education programming available. So for graduate student interns, this is an opportunity to participate in a paid internship with a U of M faculty member on a global health topic. And if you're a faculty member, this program is an opportunity to support your team with a paid intern. So please contact Ilana Rodriguez for more information on that. And then last but not least is our Impact Scholar program. This is a program that supports postdoctoral researchers who work with U of M faculty mentors in LMICs. The due date for these applications are in November, and please contact Tanya Piotrowski for more info on those. And in closing, I just want to thank all of you for joining us, and a special thanks to Preet for presenting, and we hope to see you again at some of our other events.
Many thanks to everybody for being here, and thank you very much, Preet. Have a good rest of the day.